Hello, welcome to the University of Florida Department of Anesthesiology. First, I want to congratulate you for making a great choice to be here, to come and even virtually give us a chance to show you what a great place this is to work and to train. This is the hub of innovation. If you are able to walk around our building up in the fifth floor, and you will see the number of patents that most of our attendings and some of our residents hold, you will be amazed by the amount of innovation that goes on every day in both the clinical arena and in our labs. That is the reason I chose to come here. That is the reason I remain here, and this is the reason the people who are involved in teaching and in education of residents are happy to be here. You are going to find a place where you're able to express yourself. You are able to be yourself within a family of residents that support you, that will hold you accountable, but will always be looking out for you. To me, that is one of the hallmarks of a great place to train. From the top down, there is a commitment to recruit and retain great people with people skills, people that want to work with you. Any of the hallways, when you walk around and you see some of the most senior, most accomplished anesthesiologists in the country, you're able to stop any of them at any time and say, may I ask you a question? May I have a cup of coffee with you? And you'll be able to sit down and have a long conversation with any of them. That is the hallmark of a good place. That's why you should be here.
Hello and welcome. My name is Basma Mohammed. I'm one of the assistant professors of anesthesiology, and I'm also an assistant program director for the residence wellness. I joined that position a year ago or so, and since that time we have been actively participating in starting multiple wellness initiatives by our program, making sure that the overall well-being of the residents is being very well addressed, and also making sure that our residents have access to different resources for mental health, for wellness initiatives, and for their work-life balance. Some of the wellness initiatives that we've started since last year is to focus on didactics related to wellness. And we also introduced the body system, where we value the impact of peer support in supporting each other during our training program. We also initiated the idea of having interest groups that focus on different things, like, for example, a book club that focuses on professional development. Another interest group focuses on incorporating exercise into your daily and weekly activities and things of that nature.
Hi, I'm Dr. Joshua Sappenfield. I'm an associate professor of anesthesiology and emergency medicine. I'm also the assistant program director for didactics for our residency here. I am an associate examiner for the American Board of Anesthesiologists. I am the medical director for our pre-surgical clinic and the chief of the perioperative division. And I'm also one of the co-captains for the Racing Challengers, one of the interest groups we have at UF. As part of the faculty here and as part of the assistant program director, I participate in mock oral exams. I actually help create our mock OSCEs here at the UF that we're doing for our residents, as well as proctored the hemodynamic monitoring section for it. I'm responsible for the didactic teaching, and so I've been part of upgrading our CA1 keyword reviews on Tuesday mornings, as well as moving our didactics virtually for the coronavirus pandemic. As a co-captain for the Racing Challengers, last weekend I participated in a triathlon. Last spring we had 36 of us do a virtual obstacle race, and I think we had 20 of us last fall doing a real obstacle course race. The reason a medical student would choose to come to UF for our residency is, one, the challengingness of the cases. You'll see a lot more here that you won't see at other institutions, so you'll be extremely well prepared when you're in private practice or if you want to go an academic fellowship. We are the top 10 sickest patients in the United States. We have adult congenital heart disease here. We have a huge referral center for strokes and orthopedic oncology. We do a ton of vascular cases here. And so between our lung transplant, heart transplant, liver transplant programs, and the other kinds of patients you're going to see here, you're going to be well prepared for working as attending somewhere else. The other thing is we are largely connected throughout the United States. People who come here when they graduate, go all over the United States. We've even had someone leave to get a job in Alaska. People know who we are, and we know people in other institutions. And so when they hear the University of Florida, people think not only fondly, but well of the caliber of residents that come from this program. It also looks good for fellowship. People have actually called me on my cell phone and asked me how residents do, because they know who I am and they know the residents coming from my program. And the last reason to come here is the environment. I mean, the residents talk about how closely knit they are. When they work on mold together, when they work on rotation together, it seems like a certain type of person is just drawn to UF as a moth is drawn to a flame, essentially. Hopefully that's a good analogy. They're drawn to this program. It attracts a certain type of person, and those people like working together. And so they're pretty close.
My name is Dr. Amanda France, and I am a critical care anesthesiologist and Assistant Program Director of Education here at the University of Florida for our anesthesiology residents. I'd like to welcome you here today via video and try to give you a little bit of a heads up on what you can expect your intern year if you decide that the University of Florida is the right fit for you. One of the things that you guys should know about that is unique to UF's intern year is something called the Education Month. This is pretty special. There aren't any other programs that really give you a full 4 weeks in your intern year for education purposes. What's this month like? It's pretty great. It's 8 a.m. to 5 p.m., Monday through Friday, with no nights and weekends. At this time, they're going to introduce you to some of our resources and educational resources that we offer here at the University of Florida outside the education office, like how to use our library sources online or in person. We also help you develop study plans to help you get through the many exams that you'll encounter during your anesthesiology career. And also, this is a great time to introduce yourself to the people in the operating room, including our anesthesiology techs. There are 3 components to really know about this Education Month and why it's so important. You get classroom sessions, simulations, and shadowing. With our simulations, you get some sort of introduction to all the subspecialties of anesthesiology. You get to see OB, pediatrics, chronic pain, acute pain services, intensive care unit, neuro, and cardiac anesthesia. At the very end of your intern year, block 13, this is the shadowing or period month. This can extend from 6 to 8 weeks. This is the time for you to work with someone else from your class and an upper level resident to familiarize yourself with the operating room and learn about important things like intubation and emergence, taking care of different types of patients. You won't just be in general operating rooms, you will be in some of the subspecialty rooms as well. And sometimes watching an upper level resident take care of a pediatric patient is the best introduction instead of being in the room for the first time as a CA2 by yourself. The last thing to talk about is the Basic Skills Boot Camp. This is a period during your period where you start to learn how to be an anesthesiologist. So the Education Month will provide you the medical knowledge and a basic medical knowledge for you to start your anesthesiology career, but the Basic Skills Boot Camp really goes into the procedures that you need to know and how to do checks on your anesthesia machine, how to actually intubate. We have airway classes, what an actual crash cart looks like, so that you can go through it prior to doing your first code. And we also go over less exciting things, but also extremely important things like medical error and adverse medication events, and basically teaching you the background of those things that we don't really go over any other place. Please feel free to contact me if you have any questions, comments, or concern. Go Gators!